apart from the preset settings, the Gbox15AB also comes with customisable surgical settings and custom settings, which I use a lot for therapy. These custom settings are when you start to understand dosage principles and things like that, and you want to basically calculate a specific dose and a specific way of delivering it for each patient you come across. The example I'm going to use today is a cat we're treating and have been treating for quite a while now, Tabitha Boyle, who has osteoarthritis virtually all the way along her spine and both of her hips. She's a geriatric old cat, she doesn't handle non-steroidals at all, and this keeps her quite happy on a once every 6-week therapy. Now, from the measurements I've made of Tabitha and the calculations of the amount of energy she needs, we hit this one here, we're going to, you have 50 different settings you can put in here, or protocols I should say. So we're going to use this one here, we're going to rename it. So we just get rid of these, get rid of this here, we're going to put in Tabitha, if I can spell, Tabitha Boyle, enter, excuse me, just getting my glasses, and hit setting, and I have a treatment sheet I make up like this, and I've done my calculations here. I leave this with the nurses, it tells them exactly what I want done, where I want lasered, and they look at that, they press the Tabitha Boyle buttons and away she goes. So I've calculated that what I want with Tabitha at 980 nanometers, I want her to be treated, if you can see this, 8 watts for 150 seconds, and on 810 nanometers, 8 watts for 75 seconds. So we want this up to 8. Sorry, yeah. 6, 7, 8. You can do it that way, or we can actually do it by turning the knob down the bottom here, which you can't see, it's just down that knob there. You can turn to adjust the dose as well, or just do it by pressing the touch screen. 8 watts and 980, that's phase 1, and we don't want it pulsed, we want it on continuous wave. You can press pulse here and you can put in the frequency if you want to, otherwise I'm going to leave it on continuous wave, and then set time. We want to treat it for 150 seconds. And back. And then we're going to go on to phase 2, add a phase, so we're going to add one phase, we're going to come across here to phase 2, we're going on 810, continuous wave, again 8 watts, 8 watts, set time, it was going to be 75 seconds, back, and then we can come through here. I don't want anyone to make a mistake, so I'm going to delete the unused phases. We've got 1 and 2, that's all we need, and that's okay. Now, when we look at Tabitha Boyle, and this is her summary, it says here, we've got phase 1, 980 nanometers, 8 watts, 450 seconds, and 810 nanometers, 8 watts for 75 seconds. So when we have to treat Tabitha, and let's presume this is Tabitha's back here, we're going to have the laser like this. We'll press, we have the handpiece in our hand, we'll press the standby button down the bottom here, that one, and it'll go yellow. The aiming beam will come on, you can see that there, and we're going to treat her back by moving the handpiece up and down. Now, if this is her head up this end and her tail this end, she's obviously at a bit of an odd angle. The idea is that you go up and down like this, along her spine, like that, along like this, and then you cross backwards and forwards like this, so it's a grid position. As if you're using a rubber to rub something out. And you go backwards and forwards, and you keep doing this pattern until the time is up. Go backwards and forwards like this. Try to keep your head perpendicular to the surface of the animal, and the lasers will penetrate to the maximum. Okay. I'll just Just turn that off. And as I said, you can put in as many protocols as you like into that particular custom settings. Up to 50 different patients you can have entered in there for the specific things. The surgical settings are very similar, and I'll go into that another time, but it's the same idea. I've got one in here called soft palate resection. This is the settings I use, so I put that in. It's basically continuous wave on 980, 2.5 watts, and it just runs continuously because I control it with my foot pedal, which I use for the surgery. And it's the same thing. If you go back to home, you'll see that in the surgical one, there is 15 protocols you can have in there for different surgical procedures. Typically it's going to be skin, dental, soft palate resections, things like that. Most of them will be fairly similar, but you can do that as you go along. The surgical one, I'll warn you, takes a little bit more time to get yourself organised and learn how to do it. It takes a little bit of skill. Not as much as ultrasounding, but it does take a little bit of skill. The therapy, on the other hand, is basically a no-brainer. Anyone can do it with a very limited knowledge.